Welcome, and thank you for viewing this video on barriers and facilitators to the acceptance of medical countermeasures. My name is Suzette McKinney. I am the co-chair of the National Academies Forum on Medical and Public Health Preparedness for Disasters and Emergencies. I am also a member of the Planning Committee for this workshop series. The purpose of this recording is to provide context and historical grounding to the discussions that will take place during the workshop series on medical countermeasures, expanding delivery and increasing uptake through public-private partnerships. Throughout the workshop series, concepts of trust, perception, and health equity will be highlighted in case studies and discussions. These factors are critical to the success of a medical countermeasure response and the acceptance of medical countermeasures among communities. There are multiple social and behavioral factors that might influence the acceptance and uptake of medical countermeasures that you might hear about throughout this workshop series. This framework for behavioral and social drivers of vaccination provides an overview of some of the influences that may lead to individuals receiving a vaccine or other medical countermeasure, such as a medication or diagnostic test. Perceptions of disease, including the perceived benefits and safety of a medical countermeasure in preventing or treating that disease, in addition to social norms and processes that contribute to motivation, trust, or hesitancy toward accepting or utilizing a medical countermeasure. More practical issues, such as access and affordability, can then prevent or promote uptake of medical countermeasures. Legacies of injustice impact hesitancy toward medical countermeasure uptake among some communities, particularly minority communities. The most well-known examples of medical and research mistreatment that occurred between the 1930s and the 1970s include the Tuskegee syphilis study, in which hundreds of African American men were lied to about the nature of the experiment and not treated for syphilis despite the availability of penicillin as a treatment. Instances of unconsented sterilization of Latinx and American Indian and Alaska Native women also occurred during this time. The framework for equitable allocation of COVID-19 vaccine discusses these examples as well as approaches to address hesitancy and trust in vaccines. Trust in public health emergency preparedness and response is influenced by a variety of factors, including individuals or institutions that are seen as trustworthy. Levels of public trust often change depending on the type of public health crisis. Misinformation and disinformation are also contributors to mistrust. These concepts have been explored in past workshops hosted by the National Academies and are listed here on this slide. Placing people and communities at the center of the medical countermeasures enterprise is an approach to improving confidence in medical countermeasures. This can be done through placing value in both biomedical and social science contributions, embedding social, behavioral, and communication science in a medical countermeasure response, seeking active participation of communities in medical countermeasures research and implementation, as well as applying human-centered design principles in medical countermeasures programs. Workshop 2 of this series, which will be titled Public-Private Partnerships for Acceptance and Uptake of Medical Countermeasures, will present case studies of public-private partnerships that have sought to improve public acceptance and perception of medical countermeasures through a focus on local capacity building, addressing the needs of highly vulnerable and historically marginalized populations, and sustained community engagement. Thank you for viewing this video. We hope that you will join us for this workshop series in its entirety.